So next we have Dr. Prateek Sharma joining us online, the President of American Society for Gastrointestinal Endoscopy. And I salute him for last year in a conference. He first time breached the topic of digital health in society. And I was had the privilege of being in the University of Kansas. Dr. Prateek would like to hear your views on digital health transporters. Over to you.
Okay, thank you. And can you hear me, Rajendra?
Yes, loud and clear.
Okay, perfect. First of all, good afternoon to everyone there and good morning from Kansas City. And thank you, Rajendra. It's indeed my honor to speak. And I think I speak on behalf of a lot of gastroenterologists and endoscopists, not just in the US, but globally as a partner in this movement that Rajendra has started about digital health without borders. And we just heard about it. I mean, so this is not just about technology, but it's ultimately going to be about access. We heard the example of cervical cancer screening in Africa. So it shouldn't be just limited to where a patient lives, whether it's urban, rural, wealthy, underserved, but that the fact that they can access high quality and personalized healthcare. So now I'll just focus a few minutes just on what we have been doing. And in gastroenterology and endoscopy, we have seen firsthand how digital health can transform care. We have systems now that can detect early cancer. So whether you're performing a gastroscopy to look for gastric cancer, esophageal cancer, or a colonoscopy screening for early colon cancer, colon polyps, the COVID pandemic taught us, remote consultations that we have been able to do in rural areas, believe it or not, in the US also for specialists requiring liver transplant. We are now testing models for training young physicians in low resource settings. So the digital tools can equalize all these gaps. The American Society for Gastrointestinal Endoscopy, we are proud to be part of this effort. We started off initially with a task force about 5 or 6 years ago. And last year, we initiated what we are calling AIGI, which is our AI Institute for Gastroenterology and Endoscopy. This is based on 4 pillars. Education training is one pillar. Advocacy is our second pillar. Practice operations is another pillar. And then the fourth is standards and quality. We have invested a lot in AI education. We are doing a lot of hands-on workshop. I mean, Rajendra was talking about that, a global training program. And last year, we started what's called the AI Scholars Program. And this is something that is unique. And, we're happy to share this information. Scholars can join us from all around the globe. This is a 1-year sort of a remote program that we do in which we are trying to train the next generation of physicians in digital health and artificial intelligence, in which for a year they get a mentor, a content mentor, which is a physician, and then also a computer science / data science mentor to get them involved in this. We have been forging partnerships to make advanced endoscopy training program available to physicians in remote areas of Africa and Asia, as well as in Eastern Europe, where access has been limited. And we are also supporting frameworks locally for ethical AI use, patient privacy, as well as responsible data sharing. A few months ago, I met with members of Congress in Washington, D.C. I mean, we know that the U.S. Right now does not have a firm policy on AI and healthcare. And so we are trying to urge Congress to do that. And they have formed within Congress also a task force of AI and healthcare. So we're keeping that dialogue, open. But again, I mean, as a society, we have to be concerned about these technologies so that they may not widen the gap rather than bring this gap together. And that's why, I think Rajendra's and WHO's idea about this digital health sans borders, is very important. So, whether it is somebody in a rural part of the world looking for colorectal cancer screening using an AI tool, which can be done digitally now with the help of stool DNA or FIT testing, or learning more advanced endoscopic procedures, which can be taught virtually. I think that's the future, and that's where I think all of us can work together. So, Rajendra, again, my thanks to you for leading this effort, and delighted to be a part of it. Thank you all.